getting ready to start. I've already done infraorbital nerve blocks and infiltrated a little local anesthetic in addition to drawing the pictures to do a lip lift procedure, sometimes called a bullhorn lip. As you can see, the shape of what we're planning to excise is somewhat shaped like a bullhorn. And basically what this does is resect a little skin and turn the lip up so you get a little bit more vermilion show. So we're going to get started. Still doing all right? No pain, correct?
No pain. I'm actually really surprised. Like, the needles weren't even that bad.
Good. So in this procedure, the idea is just to take a full thickness of skin out and leave the muscle underneath alone, which we are achieving right now.
Does it look like a little mustache? My mustache would be my question. Right. Like, it's so quiet.
Perfection.
Yeah, I was thinking it was awfully quiet in here. Used to having music, I forgot to turn it on.
I may have taken an Advil about 4 days ago.
It's all right. I really don't think it makes enough of a difference to make any difference.
Okay.
It's just the nature of this procedure. It's a little bit bloody.
Okay.
If I let the local anesthetic sit for 15 minutes, it would have decreased it a little bit, but I don't think it's worth the wait.
Now I'm asking you a question. Sorry, I keep picturing
can't
this little
resist.
mustache. I just, did you take a picture of the mustache, babe? Before they throw it away. My little buddy.
Let me, I'll put it out for you to get a better picture of it here in a minute. Let me get this bleeding to slow down a little bit.
Feels really good.
Pretty good. Just hold pressure on it for a minute or so to get that last little bit of oozing to stop, and then we'll close it up.
Is that an Allergan electrocautery? What type of?
Closing now.
All right. Hey, like I said, I'm looking forward to the fact that it's going to be better regardless of what. At least now I don't have as much lip or that white thing. Thank you, guys.
You're welcome. I think things look good right now.
I do too.
Yay. That's a big deal because Charlie loves to talk shit. So. He always takes jabs like all the time, so that'd be awesome.